They're cute, they are cuddly, and they may just hold the cure to coronavirus. I'm at Serenity Hills Ranch here in Florida, and I guess this is proof that scientists will look anywhere for a solution to coronavirus. This is LJ Littlejoy, sister to another llama, the donor llama by the name of Winter, that may help us all solve this pandemic. Llamas, a domesticated animal from South America, are both intelligent and social.
She's very alert. She's extremely aware of everybody.
Very friendly.
But they may also have something special.
Llamas and other camelids produce an unusual type of antibody in addition to a conventional antibody that humans make.
Scientists have long turned to llamas for antibody research, from HIV to influenza. In 2016, researchers were studying 2 earlier coronaviruses in a llama named Winter in Belgium. Now her antibodies from a blood draw are being studied by a team of researchers who were funded in part by the NIH to find a treatment for COVID-19.
You can think of it sort of like one side of a piece of Velcro. Right? So the virus has a bunch of these sticking out. Our cells have the counterpart to it, and it tries to stick and attach the virus to our cells like Velcro. And what we're trying to do is come up with an antibody that can bind and cover one side of the Velcro, and then it can no longer stick to our cells.
And if you can do that, then the coronavirus no longer becomes a threat to us?
That's right. We've prevented it from attaching to our cells and infecting us.
If coronavirus is like an invading army in our body, then what are the antibodies?
Yeah, the antibodies are the soldiers that we've trained to specifically recognize that invading army.
And destroy it?
And destroy it.
Scientists will then take Winter's antibodies and synthetically create a copy of that antibody as a treatment for COVID-19.
Would you inject this to somebody who doesn't have coronavirus?
Yeah, potentially. The antibodies can be used in 2 different ways. They can be used prophylactically before somebody is infected, and this can be really advantageous for high-risk people that maybe are likely to be exposed to the virus. You can think of like healthcare workers, nurses in hospitals. You can inject them. They would probably be protected for 1 to 2 months. The antibody titers would wane over time, so they would need another injection every month or 2. But this would protect them from hopefully getting infected.
And what about people who already are infected and are trying to fight COVID-19?
Yeah, and that's potentially the other way, is using the antibody for treatment. Particularly if it's early on in the infection, there'll be some time window, maybe a few days after infection, where you could administer the antibody, and then it will help their bodies fight off the virus. And maybe that will decrease the severity of the disease or shorten the number of days in the hospital.
The researchers are now preparing to conduct preclinical studies in animals, then testing in humans in the hopes to find an antibody treatment for the COVID-19 pandemic.
Is Winter going to be our hero?
I hope so. Yeah, Winter's been retired. She's living comfortably on a farm in Belgium. She's produced a really interesting molecule that's being pushed forward rapidly for clinical development.
Such a strange place to be looking, but I guess that's what you do as a scientist.
Yes, that's what, as part of science, it's important that we explore. Exploration leads to the development of these new types of interventions that could potentially save us from a pandemic.
When might scientists actually have an answer if this is going to work? Well, it is science, and researchers say it could be tomorrow, it could be months from now, it could be years from now. That's just the nature of research. But they are hopeful, and if you're wondering why they chose the llama, there is another animal they could have used, the shark. Certainly a lot easier to work with a llama than a shark. Guys, back to you.
I am a charge nurse at the St. Francis Downtown Emergency Department in Greenville, South Carolina, which recently has been identified as a hotspot in the United States. When I first heard Greenville and hotspot in the first sentence, I got chills. Hotspot to me is New York City, freezer trucks with bodies in it, and I quickly went into denial. It's not possible. Greenville can't be a hotspot. We can't handle that. And then I looked at my board at work, the track board at work, and saw how many patients that were there with COVID complaints and realized, no, COVID is here, and it is getting worse.
Today started out with 62 patients in our facility, which equals the highest we have seen, up from about 31 a little over 2 weeks ago. So certainly a concerning uptick that we've seen lately. But now as we begin to open up the city, we've seen more viral spread, more cases, and then a couple, 3 weeks later, predictably, more cases in the hospital.
I remember taking care of one patient in particular, not but 3 years older than I am, no medical problems, healthy, and watching this patient struggle to breathe, gasping for air because of COVID.
We've had families that one person has had it and then everyone comes down with it. While I've seen where we've had families where one person has had it and nobody else has caught it, and it all depends on your technique. It all depends on isolating yourself, wearing your mask, hand washing, sticking to the rules that can help you get it prevented. So it's very important that you stick to the rules, wear your mask, social distancing, it is real.
It's also been very frustrating because we're seeing a lot of patients who are sick who don't need to be sick. This is the kind of illness that if you take some simple measures, you do a few easy things like wear a mask, have some social distancing, wash your hands, you can help stop the spread of this. And the fact that a lot of people aren't doing relatively minor things to help protect their neighbors, to help protect their family and friends who have cancer, who've had bone marrow transplants, who've got sickle cell, who have cystic fibrosis, diabetes even. The fact they're not doing that, it's a bit frustrating that we're not all trying a little bit harder to be good neighbors.
It's better to be a warrior in the garden than a gardener at war.
Warriors in the Garden is a collective of activists.
We're out here protesting every day.
I like to say we kind of form like the Avengers. Like
1, 2, 3, Warriors!
I'm just walking down Fifth Avenue, just like doing some photo work or whatever, and I see 1,000 people walking down the street protesting. I'm like, wow, like this is something. Who's leading this? You get to the front of the line, meet one of our leaders, and I'm like, wow, like you're a kid, like. This is crazy.
I was going to a protest and I just asked to speak because I noticed no black women were speaking.
I've said this before and I'll say it again. I used to hate myself just because I'm black. That is the world I live in. And to my black queens, I know what it's like. Yeah. I know what it's like to be the lowest standard of beauty because that's the world I live in.
And yeah, I think they were kind of like, we need this girl, and so here I am. It's every new problem we bring up, we must bring up a solution as well.
I think we understand that. We understand that this fight and dismantling white supremacy is multifaceted. I mean, we need to be protesting, we need to be posting online, we need to be voting, and we also need to be running for these positions of power. My name is Chi Osei. I'm 22 years old, so I am Gen Z. I'm black, I'm queer. I'm running for City Council District 36, which is Crown Heights and Bed-Stuy.
This is my 23rd day protesting, both physically and virtually. I'm tired, but I am more tired of white supremacy.
My political ambitions are defunding the NYPD, reallocating those funds back into education in the neighborhoods that they've distraught. I also want to tackle the housing crisis.
And one of my concerns in terms of changing law enforcement is how judiciously the law is enforced in which communities, because if we do change it, what's stopping an officer to apply it the same way they do in the Bronx as they do in Soho? And recently from anonymous accounts, I've been receiving death threats. It's just really scary, but we still won't stop. We're still motivated. We're still going to coalesce, and we're still going to reach our goals. And it's intimidating, but because we're a group, we're okay.
My running for city council is a win-win situation. Even if I don't win the election, I think I'm starting a conversation. And not only will the city hear, but the country will hear what I have to say. And I think I'm vocalizing what needs to be vocalized.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.